Thank you, Madam President. Colleagues, I bring to you Senate Bill 738. It's a dental bill. It's an oral health bill. The current dental workforce model in Oregon is not meeting the needs of all Oregonians. There are so many disparities in oral health, and they can be found in all different types of populations all across the state, including those with special needs, low income, minorities, underserved rural, urban, and frontier communities. Oral health is important of overall health, and as such, all Oregonians should have access to oral health, prevention, and basic services. And this does not occur in this state for all people, and Senate Bill 738 starts to deal with this problem. Maintaining the status quo in Oregon is no longer acceptable. Oregon can do better. Think about this. More than half of Oregon's licensed dentists live in the Portland area. And 22 of Oregon's counties have some type of professional shortage. In 2009, Oregon had 2,589 practicing dentists, but only 1 out of 5 of every dentist take Medicaid clients. On November 22nd and 23rd last year, thousands lined up at the Oregon Convention Center in freezing cold and rain to receive charity dental care. The Oregonian on November 29th reported charity care for bad teeth is wonderful, but what Oregon really needs is basic dental care for everyone and no begging required. We, as a state, are transforming health care, and in the way we deliver health care. And we have to change the way we deliver dental care in order to keep with the mission of our state, our health care reform in this state. I feel the timing of Senate Bill 738 is perfect. It is imperative that we look at all kinds of ways to deal with access and our limited healthcare workforce and scope of practice. This bill deals with dental needs and dental scope of practice. There are other states and countries with different models in delivering dental care, and our Health Policy Committee had representatives from Alaska, the Northwest Health Foundation, and the Kellogg Foundation present to us about work being done in 50 other countries and the state of Alaska and Minnesota, and they shared models used in New Zealand, which they've been using since 1920, Canada, which they've been using their model since 1972. How they have used the dental professional program is very different than how we are delivering health care here in the state. In November 2010, the Kellogg Foundation announced that it was going to support efforts in 5 states to pursue a similar model using dental professionals as part of an expanded dental team to end severe dental care shortages across the United States. That foundation is investing $16 million by 2014 to 5 states, and those states are Kansas, New Mexico, Ohio, Vermont, and the state of Washington to the north of us. These efforts are going to build awareness of oral health access issues and bring quality dental care to every community. But you know what? Oregon can't take advantage of those innovative programs and that money. And this legislation is going to allow that. I want Oregon to be a state that can participate in these programs. We do need to take advantage of innovative ways to provide access to dental care. What is so exciting about the contents of this legislation is we had consensus. It's a scope bill, and we actually had consensus after the mediation process. The Dental Association was at the table. In fact, Dr. Terry Baricello was a part of that mediation process, and she's president of the Dental Association. We were in consultation with the Dental Hygienists, and the Oregon Oral Health Coalition was also there. Dr. Gary Allen, a dentist, was also a part of that process. We definitely had opposition in the beginning, but these groups paid thousands of dollars and spent months of work to come up with the contents of what you see in Senate Bill 738. It is a consensus bill, and there is no opposition from any organized group. There are 3 sections to the bill. The first section deals with pilot projects. They're overseen by the Oregon Health Authority, but those pilot projects have to be in consultation with the dental board and all the professional organizations. And these are pilots only, and they're going to be evaluated to see if there are ways Oregon can deliver oral health in a different way. Let's see what those models are and if they can work in Oregon. The second part of the bill deals with the expanded scope of dental hygienists, and it is very specific in the bill what scope could be expanded. The expanded practice dental hygienist must have a supervising dentist, and there has to be a written agreement between them. The Board of Dentistry is going to write the rules for that, and therefore will designate what type of training and clinical work that they will need to do. And those scope changes are administration of a local anesthesia, administration of temporary restorations without excavation, they can't go digging around in there, prescribing prophylactic antibiotics and non-steroidal anti-inflammatory drugs, and this would be specified in the practice agreement, and overall dental risk assessment and referral parameters. The expanded practice dental hygienist has to have a supervising dentist, and it is very similar to the physician assistant model, and that model has worked for years in this state. I'm so happy that the Board of Dentistry is at the table. They had no reason to really want to change the way oral health is delivered in the state, but they were actually at the table when we were having our transformation meetings and giving input, and they truly do see the need of changing the way we can deliver oral health care in this state. The third part of the bill addresses the need for a pilot program using a community dental health coordinator. And it is imperative we do more outreach into our communities. It is a part of healthcare reform, and healthcare reform won't work without educating and doing outreach in the community of oral health. The dental associations across the nation have wanted this type of process and are strongly advocated it in the mediation sessions that we had. Senate Bill 738 is a consensus bill, colleagues, by the Oregon Oral Health Coalition, the Oregon Dental Association, and the Oregon Dental Hygienists Association. It expands dental access in a way that is responsive to the quality and public safety of this state. Please join me in supporting Senate Bill 738. Thank you.